Hi everybody, it's now 2 p.m. and you've joined the Justice and Mental Health Collaboration Law Enforcement Application Assistance webinar. To allow for late arrivals, we're going to be starting this event in just a couple more minutes. Good afternoon, everybody, and thank you for joining the Justice and Mental Health Collaboration Program Law Enforcement Application Assistance webinar. The JMHCP program is a very important initiative to help reduce the prevalence of individuals with mental illness that are in our criminal justice system and to promote further collaborations between organizations in both the criminal justice and mental health systems. After presentations today by Maria Fryer from the Bureau of Justice Assistance, or BJA, Jerry Murphy, and myself, Cynthia Kimmelman-DeVries from the Council of State Governments Justice Center, there will be time for a question and answer session. To ask a question, please type the question into the Q&A panel on the bottom right-hand corner of your screen. We will do our best to answer your question. If your question does not get answered during the webinar, please follow up via email after the event has ended. At the end of the presentation, we will provide email addresses for everyone speaking today. If you encounter technical assistance or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239, 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we are recording this event and will be emailing the recording to all of the attendees as well as posting it shortly on our website. Once again, my name is Cynthia Kimmelman-DeVries, and I'm a Deputy Director in our Behavioral Health Project here at the Council of State Governments Justice Center. I represent the team of technical assistance coordinators assigned to each jurisdiction awarded a JMHCP Justice and Mental Health Collaboration Program grant. This afternoon, we'll give a brief overview of the solicitation, discuss the law enforcement priority considerations outlined in the solicitation, provide you an overview of what specialized police-based responses are, and provide you with a number of useful resources you can use as you prepare your applications. Earlier last week, we conducted a more general application assistance webinar where we reviewed the general requirements for the entire solicitation, answered questions about the allowable uses, types of partnerships and agencies that can apply, and other questions jurisdictions might have, including budget information, attachments necessary for your application, etc. On your screen, you can find a link to the recording of that webinar, but you can also download the full slide presentation and share it with your colleagues. Today, we'd like to contain the discussion and Q&A to just the priority consideration outlined in the Initiative for Law Enforcement Strategies. While we're happy to answer more general questions or any question that you have today, we do strongly encourage you to listen to and download the slides from the first webinar if you have not already done so. Now I'd like to give you a very short description of who the CSG Justice Center is and what we do, and I'll then turn the presentation over to Maria Fryer of BJA, who will talk briefly about the general JMHCP grant program and the law enforcement priority considerations. For more information about technical assistance services that we provide, please view the first webinar recording, which explains this in more detail. The Council of State Governments is a nonprofit, nonpartisan membership association that investigates a host of different issues, from transportation, education, healthcare, and the environment to criminal justice, which is handled by a division of CSG called the Justice Center. The Justice Center has a number of different project areas we work on, including our behavioral health project, which seeks to improve criminal justice and mental health responses to people with mental disorders that are engaged with the criminal justice system. This is where the technical assistance we provide JMHCP grantees is housed. We also operate the National Reentry Resource Center, which serves as a primary source of information and guidance in the reentry field, seeks to advance the use of evidence-based practices and policies, and create a network of practitioners, researchers, and policymakers invested in reducing recidivism. Under our reentry work, we also provide technical assistance to the Second Chance Act grant program, another BJA-funded initiative. We have been the sole technical assistance provider for both grant programs since their inception, JMHCP in 2006 and Second Chance Act in 2009. Between both programs and to date, we have worked with over 1,000 grant-funded programs. To learn more about what we do and the services we provide, please visit our website at csgjusticecenter.org. At the end of the presentation, we will display all of our contact information. Please feel free to email the appropriate person for additional information, either the BJA staff for more fiscal and grant-related management issues, or either myself or Jerry Murphy as it pertains to technical assistance issues. As a reminder, we will be emailing out this webinar recording, including a link to the slides, as well as posting a link to the recording on our webinar page in archive form. Now I'll turn things over to Maria Fryer, who will talk a little bit about the general JMHCP solicitation and grant program.
Great, thanks, Maria. Thank you, Sarah. Hi, everyone. Good afternoon. My name is Maria Fryer, and I'm a policy advisor at the Bureau of Justice Assistance. And welcome back to those of you that had attended the webinar last week. I hope that it's informative today as well. And we do encourage you to also go back and review the webinar that's posted in the link provided. The Justice and Mental Health Collaboration Program, known as the JMHCP, supports innovative cross-system collaboration for individuals with mental illness or co-occurring mental health and substance abuse disorders who come in contact with the criminal justice system. A major goal of the JMHCP is to facilitate collaboration among the criminal justice, mental health, and substance abuse treatment systems to increase access to mental health and other treatment services for individuals with mental illness or co-occurring mental health and substance abuse disorders. JMHCP is authorized by the Mentally Ill Offender Treatment and Crime Reduction Act, or known as MIOTRA. In 2004, it was reauthorized in 2008. Next slide. Allowable uses. JMHCP funds a variety of programs, a very wide set of programs. Today, we will be focusing specifically on the types of law enforcement responses that have and could be funded. We thought it might be helpful to hear a little bit about the diversity in programs to give you a sense of how creative jurisdictions can be. Not only does the program provide services for system-involved individuals with mental illnesses, but programs have also been funded to provide specialized training programs for criminal justice and mental health personnel. Grantees have used their funds to create entire training academies or roll out crisis intervention training to whole precincts and counties. Additionally, programs have been funded to plan and expand mental health courts, alternative prosecution and sentencing programs, pretrial services, and other court-based initiatives. They have also been funded to provide traditional reentry and transitional services for people returning back into the community from correctional institutions. Pages 6 through 11 of the solicitation outline all the allowable uses and guidelines jurisdictions need to follow when proposing a new initiative. Next slide. And here with this link, you can find the full solicitation by following what's on your screen. Next slide. There are 3 categories or types of grants funded under JMHCP. Category 1, which we will not review today, focuses on reducing the prevalence of individuals with mental disorders in jails. Next slide. Category 2 are planning and implementation grants, which are 3 years and $250,000. Planning and implementation grants spend approximately 6 months to 1 year planning and setting up policies and procedures for their initiative, and the remaining time implementing them. These are usually new or first-time projects. Next slide. Category 3 or expansion grants are 2 years and $200,000. Expansion grants are usually jurisdictions that have an operational program and would like to layer on new services or extend their target population. A drug court, for example, that would like to start seeing or delivering services to mental health clients that come through their doors, or a probation department that wants to create a specialized mental health caseload and supervisory system. Next slide. Allowable uses. So in categories 2 and 3, the planning, implementation, and expansion grants, you'll see training for criminal justice personnel, mental health and substance use treatment personnel, enhancing access to community-based healthcare services and coverage. And in law enforcement responses, which is our priority consideration being discussed today, diversion and alternative sentencing, correctional facility grants, community supervision strategies, case management and direct services, and program evaluation. Next slide, please. Law enforcement priority considerations. Implementing or expanding specialized law enforcement strategies that are tailored to the needs of people with mental disorders. This may include, but is not limited to, a combination of the following: developing specialized receiving or diversion centers, developing or enhancing computerized information systems, developing or expanding law enforcement mental health programs, and conducting a local evaluation. Next slide, please. Developing specialized receiving or diversion centers for individuals in custody of law enforcement to assess for suicide risk and mental health or co-occurring mental health and substance use treatment needs, or to refer to or provide appropriate evaluation treatment services. Next slide. Developing or enhancing computerized information systems. Provide timely information to law enforcement and other criminal justice personnel. To improve the response to incidents involving people with mental disorders and co-occurring substance use disorders. To foster the systematic analysis of incidents involving people with mental disorders and co-occurring substance use disorders. Next slide. Developing or expanding law enforcement mental health programs. And in these programs, law enforcement and mental health professionals collaborate, make decisions that balance the needs of individuals with mental disorders with public safety. This may include co-responder programs and crisis intervention teams, where teams respond to incidents involving individuals with mental disorders and/or co-occurring substance use disorders. Evaluation of local programs, which is another priority consideration. Conduct local evaluations of existing specialized response programs such as crisis intervention teams. Applicants are encouraged to consider a partnership with a local research organization that can assist with data collection, performance measurement, and local evaluation, Please see page 11 of the solicitation for more information regarding program evaluation. Today, Jerry and team will discuss what P&I, planning and implementation, and expansion grants look like on the ground when implementing or expanding specialized law enforcement strategies. I'd like to now turn it over to Jerry Murphy.
Great, thank you, Maria, and good afternoon to everyone, and good morning to those on the West Coast. Thank you so much for joining the call today. I'm going to take a few minutes and just give you a little bit more background about the particular law enforcement program that we run here at the Justice Center, and give you a couple of examples of programs that different grantees have been able to put in place with the JMHCP funding. As Maria said, I'm Jerry Murphy. I'm Director of the Law Enforcement Program here at the Justice Center. We are the training and technical assistance provider to grantees. We also administer a learning sites program, a law enforcement mental health learning sites program. And we also develop a variety of resources to assist not only grantees, but the entire law enforcement field to enhance their ability to respond to people with mental illnesses. And I would encourage you to visit our website to learn more about our program and find additional resources. Let me talk a little bit about what we mean when we say specialized police response programs. First and foremost, they're based in a law enforcement agency, but with strong collaboration with behavioral health and other service providers in that particular community. And collaboration is really the key to this program. Collaboration exists in the title of the grant, and so it's really essential that any effective program is going to be built around strong collaboration between law enforcement and behavioral health and other social service providers and other community groups as well, such as NAMI, the National Alliance on Mental Illness, which is an advocacy group and is involved with many law enforcement agencies around the country to help them build their programs. The programs are designed and implemented to improve encounters involving individuals with a mental illness. And what do we mean when we say improve encounters? Well, one, we want officers to be able to better recognize individuals with mental illnesses. We want officers and others to be able to interact more effectively with people with mental illnesses, especially those who might be in the midst of a mental health crisis. We want to reduce the chances of injury to either the subject or to officers or to third parties. And we want to reduce the use of force by officers as well. And a lot of that is built around the ability to de-escalate encounters. A third aspect of specialized police response programs is that officers and agencies are more prepared to appropriately handle mental health calls for service. And this goes beyond just training officers in mental health knowledge and de-escalation skills, but that entire agencies look at their response programs from dispatch to final disposition to policies and procedures. Obviously, it includes training as well. It gets into report writing and data collection and information sharing. So there's a whole host of things that agencies should be looking at to improve their overall response to people with mental illnesses. Obviously, we want officers to be able to handle each individual encounter more effectively, but we also want agencies to look at their entire program and what they can do to improve the agency response and to improve the agency's collaboration with behavioral health partners. And obviously, in order for officers to be effective, as I mentioned, they need to have knowledge of mental illnesses and they need the skills to de-escalate mental health crises. And so that's where mental health training, often referred to as CIT training, is essential and is clearly one of the things that this grant program supports. The goals of specialized police response programs, or SPRs as we call them, are to prevent unnecessary incarceration and/or hospitalization of individuals with a mental illness. We want to provide alternate care in the least restrictive environment, such as crisis stabilization units, or working with other community mental health resources and services to develop a comprehensive system-wide approach to individuals with mental illnesses. We obviously want to prevent the duplication of behavioral health services as well as the duplication of law enforcement services so that you don't have to necessarily respond to the same individual who might call 911 2 or 3 times a day, or perhaps is the subject of 911 calls several times a week. And the purpose of the program is, again, to work through behavioral health partners to develop a comprehensive system-wide approach to manage that individual with a mental illness. And obviously, a fourth goal is to facilitate the speedy return of patrol units back to service. And so whether this means reducing the number of calls for service involving people with mental illnesses or being able to cut the wait times for officers in hospital emergency rooms, specialized police response programs, when they're built on that collaborative model with behavioral health and health providers, are very effective at reducing the amount of time officers can spend on these calls. Some of the common types of specialized police response programs fall into 5 general categories. One of those is the crisis intervention team approach, which is very popular and very well known, and it's based on a program that was developed in Memphis, Tennessee, and thus it's often called the Memphis model. And the Memphis model relies upon a group of officers with at least 2 years of experience self-selecting themselves to receive additional training to handle mental health calls for service. And in Memphis, they made the determination that approximately 25% of their patrol force would be CIT officers. So they have special training, and then they respond to the scene of calls, try to be the initial responder as much as possible on mental health calls, or to show up to assist or relieve officers who don't have that CIT training and knowledge. That's one type of program. Let me go through 4 others. And I'm going through what, if you will, are sort of the textbook definitions, and then at the end I'll talk a little bit about how agencies modify these programs. A co-responder model is also very popular, and this often involves, again, a specially trained officer working side by side with a mental health professional. That is, they will ride together in the same car, respond to mental health calls for service, or again, relieve officers who have taken the initial mental health call. And the benefit of the co-responder model is that the officer and the mental health professional can work together, each drawing upon their different skill sets and their different knowledge to come up with the best solution to that individual encounter. And agencies have used the co-responder model in a variety of ways. Some agencies might only use it part-time, some will use it full-time, and then some agencies, the larger agencies, will actually have multiple co-responder teams on the street at the same time. A third type of SPR is the mobile crisis team, and in this model, mental health professionals are available to respond at the request of officers to the scene of calls to help officers stabilize the encounter, to help them de-escalate the encounter, and then assume responsibility from the officer for securing mental health services for people with mental illnesses. A fourth model is a case management approach, and in this model, officers carry a caseload of individuals with mental illnesses who have repeated or recurring interactions with law enforcement. And officers, often working in conjunction with mental health professionals, work to develop specific solutions for that individual person to reduce their repeat interactions with law enforcement agencies. They may visit them, they may call them on the phone, but what they're trying to do is to make sure that these individuals abide by the treatment plans, attend schools or training or jobs as necessary, are getting and taking their medication on a regular basis. But many agencies are finding that this proactive approach is very helpful in reducing the incidence of repeat calls for service or repeat contacts with the same individuals over and over again. A final type is what we call the law enforcement generalist, and this type is that the agency provides all officers with extensive training, again often at least 40 hours, but provides all officers with extensive training around mental health knowledge and provides them with de-escalation skills, with the expectation that all officers are capable of responding to a mental health call for service and are capable of de-escalating that crisis and getting the individual the proper care and disposition that they need. And we're finding that more and more agencies are moving to more of this model in that they are providing training to all officers simply because the number of mental health calls for service seems to increase every year for many agencies, and just by using a portion of the department as CIT, that still leaves a lot of officers without sort of that CIT backup. And so agencies have made the determination that every officer should be capable of effectively responding to a mental health call for service. And the law enforcement generalist model can be and often is combined with other specialists. In fact, more and more agencies are mixing and matching these 5 different SPR types depending on their specific challenge or the resources that they have available to them. So it's quite common that an agency will use a generalist approach or even a CIT approach, but then have a mental health crisis team that can respond and augment officers, or to then use a case management approach on top of that. So you're not necessarily bound by these particular definitions, but these are some of the more common approaches that agencies are using. And again, it's determined by the extent of the challenge that you're facing, whether that be a large number of mental health calls for service or particular locations in your city that seem to be hotspots, or there are individuals that are chronic consumers. And that's why it's important, as Maria mentioned earlier, and why we are stressing the funding for agencies to be able to collect and analyze data around mental health calls for service so that you can properly identify the problem and then develop the program in accordance with that. So over the past 3 years, this program has funded a number of grantees, and we have, again, been the training and technical assistance provider. You'll see up here on the screen that in FY13, federal year FY13, 7 different agencies were provided grants. Again, in FY14, 7 agencies. And you'll see the diversity of agency size and type and region. These are small towns. I think our smallest grantee has fewer than 20 officers. Not only small towns, but big cities and counties and states as well. So we have, again, small towns below 20 officers to departments as large as the city of Chicago. In FY15, you will see that the number of law enforcement grantees doubled over the 2 previous years. And this reflects the priority status that BJA has placed upon law enforcement applications. So when you read through the grant solicitation, you will see that that language in the solicitation, that applications from law enforcement agencies do receive a priority consideration because this is clearly a strong focus area for BJA. And again, you will see the diversity of the agencies that we work with here. And I just want to point out that two of the grantees, it says Columbus, Ohio, and Oklahoma City, they are working, those two cities are working with their respective states on statewide training strategies. So that is another opportunity to take a look at in terms of not only a grant to provide training for your particular agency, but then also to work with statewide agencies or your state post to develop a statewide training program, especially to reach perhaps the smaller agencies or those that don't have the training resources that larger ones might have. So a couple of examples of some of the current grantee initiatives, and these are the terms that the grantees are using. And there's a little bit of duplication here among the terms, but you'll see that of the 28 grantees that I went through, they are being funded to develop or enhance programs around case management teams or crisis intervention teams. Obviously, crisis intervention training, many agencies receive funding for CIT training to train their officers or to develop their own training curriculum. Some agencies have made the determination that they want their mental health and de-escalation training more closely tied to their overall recruit training, and thus they might use the CIT model as a basis, but they want to modify it so that it's more consistent with their agency training goals. And so agencies are developing other mental health training curricula. We also work with a jail and a prison that are doing CIT in correctional settings. Other grantees are receiving funding for co-responder teams, others for data collection and tracking of mental health calls for service, follow-up teams, jail diversion programs, pre- and post-booking, 911 diversion, one of our grantees, because they have, it's a major city and they have a significant number of mental health calls for service, but they've made the determination that a number of these calls can be diverted at the 911 dispatch center, and so they are training and stationing mental health workers in the 911 dispatch center, and they are over the telephone being able to resolve many of these calls, obviating the need for an officer to respond on the scene. Mental health courts, other grantees have done that. And then the next few examples, mental health evaluation team, a mental health response team. These are all different variations on a mobile crisis team. And then finally, and Maria mentioned this, we are funding, the grant program is funding, in this particular case, a triage center for one of our grantees, which is really a receiving center or a diversion center. This is the term that they use. Some places might refer to them as drop-off centers. We try not to use that term because though these centers are designed to expedite the transfer of individuals with mental illnesses from officers to the behavioral health system, officers still have a responsibility to follow through and to engage with the mental health providers and not simply drop someone off at the front door and leave. So these are, again, some of the examples of work that grantees are doing. All of them are built on a very strong collaborative model between the law enforcement agency and their behavioral health partner. So I just can't stress that enough. We certainly encourage and look forward to applications from law enforcement agencies, but the successful ones will be those that are built on a collaborative partnership. So I'm going to turn it over at this point back to Cynthia for the last few slides before we go on to question and answer.
Great. Thank you so much, Jerry. That was a really wonderful overview of the types of programs that apply for JMHCP funding. There are a few resources that we'd like to share with you on the next two slides that might be helpful for you as you prepare your applications. And just as for everyone who's listening, once again, I'm going to remind you as I'm going through these resources, please do go ahead and start thinking of any questions that you might have that have come up with what Jerry and Maria were reviewing. This slide presentation, the recording of this webinar, and a PDF of the slides will be available in the next couple of days. That will be posted on our website, so I know we've gotten a number of questions already about that. So on your page right now, for the actual solicitation itself, if you have not stumbled upon it, please go to the link. That's the very first slide, the first link on your page. A link to the first webinar that we did conduct last week that I've mentioned a couple of times can be found on the Justice Center website, the second link on your page. In that webinar, as I had mentioned, we did go over all of the very specific application requirements that were general to the solicitation as a whole, and there was a lot of very rich Q&A that happened at the end of that event. And then the third link is to the planning and implementation guides for each of the different categories of grantees. We didn't mention that today, but we did mention it in the first webinar. The P&I guide, or the planning and implementation guide, is a requirement for all grantees to complete once they receive an award. If you follow this link, it will take you not only to the P&I guide that's for general Category 2 grantees, but also the specialized law enforcement planning and implementation guide that we've created for grantees. This is an excellent resource for you to consult as you plan and outline the implementation of your initiatives. It is not necessary for you to complete this guide now or for additional supporting materials for your application. You will complete that as a project with your technical assistance provider. The next few resources, the top one is a link for general information on the JMHCP grant program at the BJA website. The next link is a really wonderful link for you guys to keep handy and very important. It's the hotline for the OCFO office, their customer service desk, who will be able to answer any budget questions that you have to ensure that you're meeting all of the financial requirements that are set forth in the application and the solicitation materials. So they're wonderful to help you determine what to be putting in your actual budget and in the narrative. The last two resources are to the BJA Grant Writing Manual. That's a great reference as you prepare your application. And then for more information on the Council of State Governments Justice Center, on the agency that Jerry and I both represent, please follow the link that's below. Lastly, on your application, should you run into any difficulties when submitting your application or have any additional questions about the actual application itself, please reach out to the National Criminal Justice Referral Service. We'll be able to answer many of the questions that you have about the solicitation. They're open from 10 to 6 Eastern Time, Monday through Friday, and on the day that the solicitation closes, they're open from 10 to 8. They're reachable by phone, email, or by a live chat using the information on your screen now. You can also find that information on page 2 of the application. Okay, one more time, I encourage everybody to submit your questions through the Q&A box on the bottom right-hand side of the screen. We haven't had a ton of questions that have come in, so again, I encourage you to please go ahead and do that now. And if there's any questions that you feel are particular to the unique circumstances of your grant, I encourage you to please copy down one of our contact information that's on the screen in front of you and reach out to us with those questions if you think it's more appropriate for an offline discussion. Okay. Give me one second. And Maria and Nikisha, I just want to remind you right now, if you can please make sure to take your phones off mute to help answer the question. Okay, the first question that's come in. Would including a program evaluation component for all applications, regardless of the category or project, help increase application success? Maria, I think I'm going to throw that one to you.
Sure. So program evaluation and data collection is a priority consideration, which means that it does, in fact, strengthen your application. We're looking very closely at those applications. It's so important to collect data and have a plan for collecting data at the onset. It is not required, but it is strongly encouraged in a priority consideration. It can also help assist you in sustaining your program. So for future consideration, it's a great thing to do all the way around if possible. To just encourage you to partner with an academic institution And if you need any assistance, so please reach out.
Great, thank you. Jerry, these are directly to you regarding a couple of the jurisdictions that you mentioned on your slides. Someone was wondering where the pre-booking jail diversion program is that currently has the grant, as well as the triage center. I don't know if you know the top of your head, the specific geographic locations.
Yeah, so the triage center is a grantee we're working with in Florida, Osceola County, Florida. And so they are using their funding to, within the community mental health center, to expand their facility size, literally, and then to include beds in this new space that is being used as a receiving and triage center. So officers will bring individuals with mental illnesses to the triage center, and they will often stay there for 72 hours, at which point the community mental health center can triage them, can assess them, and determine the right resources and services that they might need.
Great. Follow-up to that also, just while you're answering that, someone was wondering where existing 911 diversion programs might be located.
So that is the Houston Police Department that is piloting that program. This is the first effort that we know of like this. Obviously, City of Houston and Harris County is an enormous city. Houston's one of the 5 largest cities in the country, so they receive a large number of mental health calls for service. In 2015, they received, what they were able to document was 32,000 mental health calls for service in a year. So, and quite frankly, they believe that that is an undercount. And so they know that based on their experience, and this is why it's really important to try to keep track of your data from the time of dispatch through officer records, and then through analysis of that information as well. By keeping track of that data and doing the analysis, Houston was able to determine that many of these calls didn't necessarily require an officer to respond on scene. It wasn't an urgent situation, it wasn't crisis, that maybe the caller was just looking for information on services or resources, and thus, many of these could be handled over the telephone. This is, many of you, might be familiar with the term, differential police response or telephone reporting units, et cetera. So this is modeled on that, knowing that at a moment's notice, an officer could be dispatched if that's what was required, but the belief that many of these could be handled over the phone.
Great. Is there a written guide for applying for the grant? Maria, I'm going to take a stab at this one. There are a few different resources that are available to you to reference while you're applying for the grant on the resources page that I had brought up before. There's the BJA Grant Writing Manual. That's an excellent resource. I'd also like to refer to you to the Planning and Implementation Guide for Law Enforcement Grantees. We've put an extensive work into that guide for your reference when you receive that award. However, that guide walks you through basically soup to nuts in planning and implementing your initiatives, from building your collaborations and which stakeholders to bring to the table, to forming specific teams, which players should be involved, screening and assessment, data collection, sustainability, if you're going to be using any specific types of evidence-based practices. So I can't encourage you enough to take a look at and read the P&I guide. It's actually the exercise that you will be doing with your TA coordinator as you're planning and implementing your programs, and walking you through to make sure that all of the elements that are in the guide are things that you guys as a team have thought about. Lastly, I'd actually like to refer you to the solicitation itself. If you've completed one of these solicitations in previous years, you may have noticed that the specific applicant review information, it starts on page 31 of the solicitation. where it outlines what you put in the statement of the problem and what you put in your project design and implementation sections. BJA has done a fabulous job this year of giving you almost everything to put in every single section for each of these applications. There's 6 bullet points under category 2 and 3. There's a bunch of other bullet points regarding law enforcement responses. I think there's 4 or 5 of them. They also outline under the bullet points the capabilities and competencies and what you should specifically be putting in there. So I'd say that Maria and her team have done a really excellent job this year outlining every single thing that needs to go in every excellent section. Jerry, you wanted to add something?
Yeah, just one other thing. Again, if you are able to visit our website, you'll see that we have a number of publications on this topic, and I would stress that you, in particular, take a look at one document. In particular, it's called The Essential Elements of a Specialized Police Response. And this document goes through what we believe are those 10 essential elements. So whether you're doing CIT or a co-responder or a generalist model, there are 10 factors, 10 principles that we believe form the foundation of any successful program. So we don't advocate for any particular type of program, but we do strongly advocate that whatever program you do design include these 10 essential elements. In addition, if you go to, again, our website, there is a law enforcement tab on our website. So click on there and you can find our resources. But you'll also see a very recent post on there on an article that was in our newsletter most recently on the co-responder program in Overland Park, Kansas. So this program was funded and expanded through the grant dollars, but it gives you an excellent example of one co-responder program and how that works on a day-to-day basis.
Great. Thank you so much, Jerry. Jerry, Maria, I think I might need a little bit of help translating the next question. I think I understand it, but you guys might need to help me take a stab at this. Does the law enforcement agency need to apply with the Behavioral Health Department via MOU, or is this a separate grant? I understand the first part. I'm not sure the separate grant part that I'm understanding.
I'll go first, and Jerry, feel free to jump in, but this is a collaborative program. Not only it's necessary to successfully implement and serve the population and the community, but it is also required as overall component of the program. It is a collaboration between the government entity or the criminal justice agency and the mental health authority. There's a number of different ways that we see that collaboration, depending on whether overall to JMHCP, whether it is overall a corrections agency or a law enforcement agency. It happens in different ways, but we see, in terms of law enforcement program, it is a collaboration. I'm sitting there thinking, going back to our previous webinar, whether the MOU is actually, when you apply, if the MOU, the Memorandum of Understanding, is listed as a mandatory document. I think it's a required document, and when you do apply, you'll see it as a required document. We do need to have that at time of application, and I know for some states it can be a process of procurement, and that can take some time, but you should be able to at least identify, and I think if you have additional questions about establishing the time frame to establish a memorandum of understanding, I think it's important that you reach out to us and let us know what the circumstances are. But you do need to identify a mental health authority as a collaborating partner at the time of application.
Can I clarify something about that, Maria? Actually, does it need to be a mental health department or authority, or can it be a representative and treatment provider of that mental health department or authority?
A provider, I believe. So as a representative, Jerry, did you want to comment?
Yeah, so some, just following up on Cynthia's comment. So some states or counties have, in essence, sort of privatized some of their behavioral health services. So, the community mental health center in a particular county might be a private entity. It might not be part of the county government, but they act as the agent of that county government or act as the agent of the state. And so, yes, we work with grantees where the provider is not necessarily part of the local government, but acts as that government's agent and is authorized to do that.
Great.
Thank you.
Thanks so much. This is an easy question. Are all grants electronically submitted? And the answer to that is yes. I think it's been quite some time since anything has been submitted by paper, and everything is done, and there are instructions for all of that towards the end of the actual solicitation. If you have any trouble with any of that electronic submission, there are a number of specific steps that you need to take in order to submit your application electronically, all of which are walked through very explicitly in the first webinar. But if you still have questions, the number for the National Criminal Justice Referral Service, NCJRS, on page 2 can help walk you through all of those pieces. This is a great question. If we were one of the cities that received the grant in 2013 for CIT coordinator, and we would like to now collaborate with community mental health to develop a co-responder program with law enforcement, are we only able to apply for the expansion grant? Nope, absolutely not. You can apply for a planning and implementation grant, especially if you are still in the process of planning that initiative and you're not sure what that's going to look like. I would say we probably would encourage you to apply for a P&I grant rather than an expansion grant. Okay. Will general law enforcement de-escalation training apply in this case?
That's a good question. So I'm not sure I can answer that without sort of looking at your curriculum and what you are thinking that the grant funding would be used for. So if you're looking to develop a new curriculum or expand the training to others, it doesn't have to be the CIT curriculum. Yeah, I'm tending towards yes, it would cover that, but I'd be glad to handle that. If someone wanted to email me or give me a phone call, we could talk through it a bit more.
Yep. Thank you. Have big cities like New York applied for this grant? Absolutely.
Yep.
They haven't just applied for the law enforcement priority consideration of this grant, but New York City, Los Angeles, Houston, Miami, Chicago.
Charlotte, Boston, Cleveland, Albuquerque.
Yep, pretty much all of them have applied for some variation of a JMHCP grant, not necessarily law enforcement priority consideration or a law enforcement initiative, but some type of collaboration between a criminal justice and mental health partner. Since Jerry, this is mentioning New York specifically, I'm not sure if New York has had a specific law enforcement-focused grant recently.
I don't believe so.
No. And just as a reminder for everyone, as Jerry showed on his slides, in fiscal year 15, the number of law enforcement grants that were awarded was almost doubled from the previous years. So the types of law enforcement programs that were funded at the beginning of JMHCP look slightly different than the types of law enforcement programs that have been funded now, probably looking a little bit more like traditional CIT training when JMHCP first started. Okay. This is a great question. There's a P&I, it seems, specifically for law enforcement agencies. That is correct. Also, there's a P&I based on Category 1 and 2 and 3, also correct. Which one should we be looking at if we are a law enforcement agency considering a Category 2 grant? I would say Depending on the type of initiative that you have, there's similar information in the two of them. At the beginning of the guides, there's some basic principles that we set forth that are pretty much consistent across the board. The types of stakeholders we want you to have at the table, how often you have meetings, who should be represented, data collection, sustainability, those types of things I think across all of these programs are pretty consistent and the same. As far as the actual design of your initiative, the law enforcement guide will get a little bit more heavy into what that looks like. So you might want to take a look at both of them. If you're looking for more specific information, I think about the sections within law enforcement that you would want to reference. I can't tell you the sections off the top of my head, but you're welcome to email me and Jerry, and we can refer you to the places in the law enforcement guide that are a little bit more relevant. But generally speaking, a lot of things in them are the same. There are some enhancements, nuances to the law enforcement slide, to the law enforcement guide. Jerry, somebody would like to know a little bit more about the data collection and tracking project, if possible.
Yeah, so this is a grantee that is working to improve its ability to count the number of mental health calls for service. So they are sort of modifying some of their forms and reports and using this to make better connections between their CAD and their RMS as well.
Great. This was already asked once, but we just want to review it one more time. Which departments receive grant funding for embedding mental health professionals in their 911 call centers? I believe you said it was Houston?
Yes.
Okay. This grantee is looking, potential grantee, is looking at that very option at the moment. They're interested in more information.
Okay. I would ask them to contact me through email or telephone, and rather than just broadcast that to the world.
Yep. Yeah. Jerry can also, I think, probably have you date Houston and learn a little bit more specifically about what they're doing, if that's helpful in your project design. Would it be advantageous to have a variety of training programs for police officers, dispatchers, jailers, and paramedics, or is the focus solely on police officers?
No, as a matter of fact, we strongly emphasize that CIT-type training be provided to dispatchers, to call takers, to jailers, to ambulance drivers, firefighters, probation. So, many agencies begin with training their officers, but because the mental health calls for service cut across so many different individual agencies in both the criminal justice and behavioral health systems, communities have found that this type of training for anyone who's involved in some capacity in these calls, whether on the front end or the back end, really benefits from this training. And it's really important. I really stress the training of call takers and dispatchers as well, because they're the first ones who have contact, and it's so critical that they gather as much information as possible as early as possible so that, number one, they can inform officers' response to that particular call. And then that also helps the agency be able to better count and track mental health calls for service. Many of you might know that it's sometimes hard to count these types of calls for service because they don't always come in, if you will, as a mental health emergency. They're disturbance calls or trespassing calls or domestic violence. They come in a variety of different ways, and it isn't until the officer gets on scene that they make that full determination. But by training your call takers and dispatchers, and indeed perhaps providing them with some additional screening questions, they're much better able to identify those calls as early as possible and collect as much information as possible to allow officers to effect an appropriate response.
Great. Thank you so much, Jerry. And just for everybody, I have about 4 or 5 more questions left. So in case you're still lingering and not sure if you want to type in your question, please do go ahead because we'll be ending fairly soon. Maria, you and I can help answer this question, I think. Can an organization apply for and be awarded more than one category at a time in this grant? So can somebody be awarded a Category 1 and a Category 2 simultaneously?
Yes, Cynthia, it can happen. I would just suggest that they are very specific to those categories and taking very specific, different directions specific to Category 1 or Category 2. We oftentimes get that question between Category 2, planning and implementation, and then expansion. So just really read the solicitation very carefully. But yes, it is possible.
And I'm going to go on I'm going to go on record and say that it is more common for programs to be awarded a Category 2, like a planning and implementation, in 1 year, and then the next category of grant the next year, so expansion, for example, or 2 years later. I cannot remember in the last 4 or 5 cohorts any jurisdiction, one individual county, for example, being awarded 2 categories of grant in the same year, just for full disclosure. And if you're interested actually in seeing who's been funded and when and for how much money and which category, all of that information is actually publicly available on the BJA website. On the funding page, you can actually search by every year, and it will give you a list of all of the grants that were awarded by county and the partnerships that have happened, as well as the amount of money that they've been funded for, in case you're curious. So that will give you an idea of the repetition that has happened from year to year. Just also as an aside as well, this is usually a question that most people have. The acceptance rate for this grant is very, very small. There's usually over 200 applicants for usually about 30 to 35 awards that are made each year. So the acceptance rate is in the low 20s pretty consistently over the last 10 years that JMHCP has been around. In case anybody was interested in that, that's usually some type of question that comes up. This is a question, I think, for Maria or Nikisha, I'm not sure. Which letters of commitment will be acceptable? Will letters of commitment be acceptable in lieu of an MOU? It may be more difficult in terms of timeline to get MOU through the government process.
Okay, so Nikisha, feel free to jump in, but I'm just going to first kind of state the difference between, if you're referring to in terms of letters of commitment, is that the same as letters of support, and are letters of support the same as an MOU? I just want to make sure that we're clear that they're not the same. Letters of support are your community members and stakeholders that are supporting what you're doing, and that but memorandums of understanding are actual agreements, and where those stakeholders are outlining their roles and responsibilities as program collaborators and what they're actually going to be doing in terms of deliverables, and operationalizing what they are going to do in the project and on the program, what they agree to do. So just want to make that distinction between support and then actual agreement. And repeat the second part of that question again, Cynthia.
Will letters of commitment be acceptable in lieu of an MOU, and that it might be more difficult in terms of a timeline to get the MOU through their government process?
Right. So letters of commitment or support are accepted. Are they accepted in lieu of? I think I'm going to fall back to the previous answer and let us know what your circumstances are. I think it's a matter of, for some stakeholders, perhaps getting on the agenda and starting that process as early as you can. I know that we're already, mid-month. I think we would have to hear what the circumstances are, but that is a required document. Nikisha, do you have anything to add?
No, I was just going to say that's exactly correct, that a letter of commitment cannot take the place of an MOU.
Okay.
Okay, great. can this be a collaboration between two government agencies, a sheriff's office and health department as the mental health authority, or do you have to collaborate with a nonprofit?
Yes, to the first part. You do not have to necessarily partner with a nonprofit.
Okay. If awarded a grant, what are the requirements, processes for reporting during the funding period? Nikisha, do you feel comfortable answering that? Because I'm not off the top of my head remembering all of the reporting timelines. I know it's quarterly and then semi-annually.
That is correct. Financial reports will be done quarterly, just as performance measurement reports will be done quarterly, and program progress reports, which is the program performance reports, will be submitted semi-annually. So you have two that's due quarterly, which is financial, and the performance measurements reports that are due quarterly, and then you have the progress report, which will be due semi-annually.
I hate to refer everybody back to the first webinar again, but we do review the performance measurement reports that are due in the first webinar. In the resources of the first webinar, so on the slide presentation, there's actually a link. It's also in the solicitation itself. I'll try and find it while we're talking, but I don't know that I can do two things at once. But there is a link to the PMT measures that you have to complete quarterly in the actual solicitation. Those measures look different depending on whether or not you're Category 1, 2, or 3, but not if you are law enforcement. So if you are a law enforcement grantee and you're applying for a P&I grant, you're completing the same PMT measures as you are for any other Category 2 grantee. Same thing goes for Category 3, same thing goes for Category 1. But you can take a look at what those measures look like on the BJA website. It's actually not the BJA website, it's a third-party website, but a link to those measures are in the solicitation. Also, I know that I've mentioned a couple of times the P&I guide. That is actually a requirement for all of the grantees to complete. You don't complete that all at once. You complete that over the entire length of the time of your grant program with your technical assistance coordinator. So your TA calls that you would have with your TA coordinator, that's us. Basically use the P&I guide as a jumping off point for conversation, and then there's sections that will ask you to complete about your planning process, your implementation process, things that you're thinking about future data collection, sustainability, and so on and so forth. We will work with you to complete that guide, and then we basically approve it and we collectively submit it to BJA. But that is a requirement for this grant program for you to complete. Okay. Category 2 applicants will complete an already initiated strategic plan for the Criminal Justice and Mental Health Collaboration Program. Must the already initiated strategic plan be established prior to applying for a Category 2 grant? Whoever asked that question, I'm pretty sure you have emailed me asking me that question in the last 24 hours, and I apologize for not getting back to you immediately. Maria and Jerry, please jump in if I'm not answering this correctly, but no, I think that what we're referring to is that we'd like you to have had some collective conversation between your entity and whatever behavioral health your working partner you're working with to think through some of the policies and procedures and the design of the program that you would like to be planning. There are different types of strategic plans that you can create, and actually prior to last year, from 2006 through 2014, JMHCP did award a specific type of planning grant that developed a strategic plan as its end goal, but that grant no longer exists. So in some ways it's referring to the type of strategic plan you can do in jurisdictions like that, but no, that's not absolutely necessary. We're hoping, or we're wondering, we're wanting you to at least have put some thought into designing the initiative and knowing that this is an area or a problem or an issue for your jurisdiction, and that's what you're responding to, which you're going to have to describe in your problem statement when you submit your application. Jerry or Maria, anything else you'd like to add to that?
No, I think you've done a good job covering that. Again, I would just draw people's attention to the solicitation that talks about required attachments or products that have to be submitted.
Okay. Maria?
No. Oh, hey, Cynthia. I just wanted to add as well, in terms of the required documentation, and we had a lot of questions around the MOU, and I understand that these documents have to get put through a kind of a local process or a county process or some other layer in the government process, and calendaring is an issue. Be sure to discuss in your narrative who your mental health partner is intended to be. You can support that with a letter of agreement, like a letter of commitment, support. If the document, if the MOU is not going to go through, describe the mental health partner and the nature of the relationship thoroughly in the narrative, provide supporting documentation such as the support letter. You can actually attach a memorandum of understanding outlining the role of that mental health partner and the criminal justice agency. Even if it has not gone through yet, you can describe when it's being calendared, when it's going to be discussed. But I do encourage you to attach it and to discuss it and to provide supporting documentation. And then if you do need to follow up with us or with NCJRS, that would be advised as well.
Great, thank you. We have a couple of additional MOU questions. These will be fast. Do you have a template for an MOU? Yes, you have to email us for those. So please email Jerry or myself, Cynthia, and we can give you samples of what those look like. We have many of them for a variety of different situations in terms of the scope of your project as well as your partners. So when you email us for a sample, please go ahead and give us a little bit of information about what you're trying to work on in terms of your initiative. 2 or 3 sentences is fine, and who the partners are that you're hoping to work with, like who you are and who your partner is. I'm not sure I know the answer to this, actually. Do we need an MOU specific to this grant if one already exists?
I think if one already exists, you're probably in really good shape, but you might want to potentially modify it to include this grant program, especially if you're developing a new type of program with this funding. You want that to be reflected in the MOU.
Yep. I think that maybe potentially adding an addendum to the MOU that you have in place, that you have your parties sign, just so that you're all on the same page, is good practice. As the TA coordinator for many of these different grants, this is an area that I know we've talked about having that MOU in place, and sometimes that's a bare bones MOU that says we're willing to partner around this grant, but doesn't have very specific scope of work attached to it when you submit your application. That's totally acceptable. As your technical assistance coordinator, what I will tell you is that when you bring your parties to the table and you start talking about the planning and implementation of this grant, it's very important that you outline specifically what you and your partner are going to be doing and who's responsible for what. I can tell you time and time again that we've had jurisdictions who said, oh, we verbally said that we're going to do this. And then you talk to your partner and you're now talking about the actual commitment of half of your police force or your mental health counselor who's going to give you 30 hours a week to do X, Y, or Z, and they're going to come back to you and say, what are you talking about? We don't have the overtime to pay for that, and we don't have the manpower to do that, and where's that person going to sit? And it can get very sticky. So I think for these purposes, more generally speaking, an MOU that outlines that you have made a commitment and you're willing to work together is satisfactory. Once you have developed the scope of work of your projects, talking about what the specific roles and responsibilities are is something that can follow up after you receive the grant award. Yep. This is a great question. Again, I'm not sure how to answer this exactly. Can grant funds be used to continue expand a collaborative program that has been defunded? Because I'm not sure what defunded necessarily means in your circumstances.
Yeah, I mean, I think the first part is yes. This grant program can be used to expand or continue to support collaborative programs. And the defunded part is throwing us a little bit, but yeah, the first part is absolutely accurate. This is what the program is intended for, to build out or expand existing collaborative programs.
I would like to add to that as well, Jerry. Thank you. Also, on the defunded part, what that says to me, there are many states and jurisdictions that had viable programs, and for whatever reason, the money was no longer placed in the, in the general budget for the state or the county, and for whatever reason. And so there, I think in that term to me, defunded, meaning that it was in place at one time and is no longer in place. But I would say yes, you are eligible as a local, county, state government, tribal entity, and if you submit according to the application of the solicitation, you are eligible.
Yep, I just got clarification. Defunded means that a CIT clinician position was lost due to a state hiring freeze after a promotion. So absolutely,
yeah.
Absolutely. I think that everybody on this phone is probably intimately familiar with what Maria just described. These programs get funded and cobbled together through a variety of different means, and oftentimes very, very difficult decisions have to be made about letting positions go or programs lapse in entirety because there's no funding for them. And absolutely, please go ahead and apply for those programs. That's exactly what this grant program is here for. Back to MOUs, another question for clarification. If it's a true letter of commitment outlining responsibilities and commitment, will it be okay in lieu of an MOU? Maria, Nikisha?
Okay, that's coming to us again. Yes, so you must have an MOU in place. I love the way you described it, Cynthia, in that a basic MOU outlining who your mental health partner is, who the criminal justice entity is. If you can get a basic MOU kind of through the layers, through the government layers, faster than one that's really in-depth describing the roles and responsibilities. If that gets it into the application, that would be the optimum. And then as you post-award are paired up with your TA provider and you get into the roles and responsibilities and you build up that MOU, we don't want to get into a situation where you think or believe that the mental health entity is going to step up, or you're going to work together, or you haven't really had those conversations around the table with your stakeholders, and then post-award, you don't have that commitment in place. So it is a required document. We do need an MOU. I would say it is not in place of a letter of support or commitment, but if you do describe in depth the relationship with your mental health entity and that you do have an agreement entering into this application process and you support it with letters of support or commitment, so you have provided supporting documentation, you've convinced us for all practical purposes that there is a commitment on behalf of the mental health entity, in that the MOU is in place, just going through, is being calendared on, on the, wherever it's going through, and that, what the date is even, where it's going to be discussed. I mean, do your best to convince us and have it in place and have it attached to the application. And then when it is signed, it needs to be current. And I would also add, as we were having this discussion, I was thinking about old MOUs with old dates on them. I would not do that. I would not attach an old one unless, you know, that's what your supporting documentation is. Make sure that it's current. Everything that you attach has current dates on it, if that's helpful.
On page 24 of the solicitation under additional attachments, Maria had mentioned earlier, and we went through this in the first webinar, there's a difference between what's mandatory and then what's required. Mandatory means that grants.gov will not allow you to proceed and submit your application if these pieces of your application are not included. Required are all the additional attachments that are on number 8, starting on page 24 of the solicitation. So MOUs, letters of support are what's listed there, and I'm going to read that just for everybody's information so you hear the language. Successful applicants must establish a team or utilize a pre-existing team of county leaders and decision makers from multiple agencies to engage in the project, and must submit documentation in the form of a memorandum of understanding, resolution, memorandum of agreement, or an equivalent document clearly documenting the express commitment of all team members that they commit to full participation in good faith. Anything else that we have not discussed, or I think that for some of these questions in general, please go ahead and email us for clarification if you have something in hand and you're not sure that that makes sense. Especially sooner than later, so that if we need to encourage you to get an MOU, we can tell you to go ahead and do that. You have just under a month left of time before the applications are due. We do have a couple more questions, and we are almost at 3:30. How do you view a partnership with the private and public sectors, mainly in law enforcement, to do de-escalation and distribute the training nationally? Say that again.
I'm not sure. I'm not sure we've ever considered something like that.
We had a grantee who recently was doing local training for criminal justice and mental health in their local jurisdiction, but developed some very sophisticated resources online that they wanted to potentially scale up to surrounding states, counties, communities. That was a few years ago.
Yeah.
But I'm not sure that we've ever had anyone in particular talk about creating that, you know, pushing that out nationally. That's interesting.
Yeah, I don't have an answer at this point. Maria, do you have any insight on that?
I can read the question again if that's helpful.
Yeah, go ahead, Cynthia. Read it one more time. I think I have some thoughts there.
How do you view a partnership with the private and public sectors, mainly in law enforcement, to do de-escalation and distribute the training nationally?
So I'm going to take a leap here. I'm thinking that this applicant is thinking about creating something that might be able to help other jurisdictions or to do, when they say nationally. The challenge there, I'm not saying you couldn't. I mean, we've had sites to create products that have been helpful before as part of their grant. They've created products that have been helpful to other jurisdictions. And I think that's one way that you could look at it through a national lens, I'm thinking. Also, I think one of the challenges there, and it's something important to consider, is that specialized police responses, base responses, are very different. They're very tailored depending on the resources, the personnel, the culture of each community, the size, urban versus rural, the size of the department, their philosophies. It's a very tailored approach. That's one thing that we've learned through the years, is that one size does not fit all. That's why this is such a wide program. It can do so many things, and it's almost by design in order to meet the needs of such a diverse country. And so it's very specialized, highly specialized to each jurisdiction and each region. I hope that answers the question.
Great. And I would also encourage you, I think that there's room for a little bit of some additional conversation around this. I think in terms of how BJA funds these initiatives and whether or not you're developing a product and whether or not or what you want to do with the BJA funded product in the future could get into an interesting area that is definitely worth additional discussion. So I would encourage you to reach out to us if that's an area that you're thinking about pursuing so we can provide a little bit more guidance around that.
Yeah, I mean, I would just stress to take a close look at eligible organizations that can apply for this funding to make sure that you meet that criteria.
I have two more questions, and then I'm going to throw in a bonus third because nobody has asked this question, and it's a little odd that nobody has. So here's the bonus that I'm throwing in. Will the grant cover salaries and overtime? And the answer to that is yes. In fact, that's probably one of the very, very common ways that the funding is structured or the budget is structured for these grants. No one's asked that, and I find it a little peculiar that no one has. So I'm throwing that out there in case you haven't thought about that. Also about covering equipment and vehicles. Does the grant cover equipment and vehicles? Nikisha?
Nikisha or Maria?
Equipment, yes. Vehicles, no. It depends. You know, that's we would have to really look into that because it's hard to pinpoint a vehicle just to the grant.
Right. Okay. And yes, I think if that's a use that you're thinking about doing, I think you should contact us so that we can give you some guidance on how you incorporate that into your budget and if it's allowable.
Yeah, so for instance, if you're looking for a vehicle for a co-responder team, you know, you have the law enforcement officer, you have the mental health crisis worker, but you don't have a car. And so would the grant cover a vehicle like that? I think we'd have to look at that closely, but yeah, that's why it has to be tied specifically to the grant.
Well, I can add to that as well. So definitely Jerry is absolutely right in terms of allowable and unallowable costs. I would suggest that you look at the financial guide, the OJP financial guide, and I believe that's in the resources of the first webinar, and it may even be in, if not in this one, I know it's in that original webinar. But typically, overall, in general, the purchase of vehicles is unallowable. And just as Nikisha stated, that anything you use, if you use the vehicle for this program, you would have to attribute the use of this vehicle specifically for this program. Very difficult to do. I would say mileage. Mileage is something that you can put in your budget, but you would have to estimate the miles and you'd have to attribute them with documentation to this program. And so I'm gonna leave it at that and suggest that you do look at the OJP financial guide for unallowable costs.
Great. To continue expand an existing program, which category would I apply under? If you have, generally speaking, policies and procedures in place, you're in current operations, you're expanding the scope of the work that you're doing to add positions, for example, to work with a different kind of population that you haven't worked with or targeting, you would be applying under an expansion category. But that's category 3, but I don't think there's necessarily really a wrong door there. There are some expansion programs, depending on how much in terms of planning policy procedures you're outlining, that can also be under category 2. We'll ask 2 questions. I'm going to be very speedy. Can a mental health facility partner up with law enforcement and apply for the grant, or does the law enforcement have to take the initiative? You need to be the authorized mental health authority, department, or agency for your jurisdiction. So not necessarily a facility. You can be the facility if you were approved by your mental health department, authority, or governing agency. So yes.
But yes, we have applications, grants that are proposals that are submitted by the authorized mental health agency, and the partner is the law enforcement agency. Only one agency has to submit the application, but again, it has to be in partnership with the other provider.
Great. I'm going to ask the very last question, and then we're going to end because I think this is just a good question. Maria, I'd love you to take a stab at this. I would be happy to answer, to include something else also. Would inclusion of additional outcome measures beyond the measures specified in the grant make a grant application more competitive?
I would say it's outcome measures that are just specific to your goals and objectives. Whether it makes it more competitive, we have a very strict peer review process, and how peer reviewers, grade is kind of a separate conversation. But I'm going to let you take a little jab at that, Cynthia.
Yeah, I would just say that one of the priority considerations of this grant is to work with a program evaluator. And Maria had mentioned earlier that there's emphasis or stress on whether or not you're doing that. And if the type of outcome measures or evaluation that you're taking a look at provides that and is getting under the category of program evaluation and really taking, I don't want to use the word rigorous, but a hard look at the data collection and practices and the way that you're measuring your performance, I think that that's all amazing, wonderful stuff. And as your TA provider, I would tell you that we love those grantees and we really love to work with those programs because it really shows that what you're developing has some good data and some proven outcomes behind it that help you maintain funding as well as get funding outside of BJA in the future to make you sustainable. So I would say that's never a bad thing.
You're not limited to what's in the solicitation. You can certainly go beyond in terms of outcomes or performance measures.
Correct. If it's going to hinder your application, however, and stop you from applying because you're trying to develop that, I'd say don't go that far. But those are always wonderful things that I think that everyone likes to see. The slides for this webinar will be up on our website and the recording in the next couple of days, as well as you'll receive a link to it from your email if you registered. I wanted to thank Maria, Nikisha, Jerry, and everyone who's partaken in the webinar today. We've gotten some really excellent questions. And please do go ahead and reach out to us if you have any further clarification that you need. And I encourage everybody to please go ahead and listen to the first webinar. There are a number of other questions that came up there that were excellent. This concludes the Justice and Mental Health Collaboration Program 2016 Grant Application Assistance Webinar. Thank you all for your attendance and participation, and thank you to our presenters. We're very much looking forward to working with all of you. As you exit this webinar, a short survey will automatically appear to ask about your experience on the webinar. We are required to report on participant responses to this sort of programming and very much appreciate your taking a couple of seconds to complete the questions that will appear. We'll be emailing a recording of this presentation after the event, and the recording will also be available online in a few days on our website, csgjusticecenter.org. Thank you very much.